Howdy everyone, my name is Elaine Webb and I'm here to teach you how to properly apply sterile gloves, which is extremely important when you're doing any type of sterile procedure. This is a skill that's going to be useful to you throughout your entire nursing career. One thing to keep in mind when you're doing any type of sterile procedure is to always in the back of your mind be aware that you're doing a sterile procedure. Know where your hands are, know where your sterile field is to make sure there's no type of contamination going on. And most importantly of all, hand hygiene. Have to wash your hands with either an alcohol-based solution or good old-fashioned soap and water, especially when you're about to perform any type of sterile technique with sterile gloves. So once I've washed my hands, I'm going to go and find the appropriate size glove. So sterile gloves can either come in small, medium, large, extra large sizes, or they'll be numerical such as these are. Totally depends on where you work for, what type of gloves they've decided to use. Either way, just be careful and be aware what glove size you use, what a good perfect fit is for you, because otherwise that can interfere when you're actually doing your technique, okay? So make sure your gloves feel comfortable on your hands. So everything inside this package is sterile. So when I open it up, at this point, the gloves themselves are still sterile because they're still contained in a sterile packaging, but because I've touched the outside of this package, no longer sterile. So you're just going to move the outer packaging out of the way and then begin to open up your sterile glove field. So just know as you're opening it up, these creases are there to help us get the package open. Okay, again, be always aware, these outer corners it's okay to touch. Don't touch anything inside. Don't touch the gloves because then you'll contaminate them. So as you're opening this up, although the folds do help us to remember where our sterile technique is, they're going to see how they're wanting to fold in on themselves. So all you have to do is just kind of manipulate them a little, pull back the edges, and then it's going to stay nice and flat. So just remember, you have a 2-inch border around your work area, your sterile field, that you can still touch with non-contaminated hands. So always in the back of your mind, remember you are performing a sterile procedure. Even putting on gloves is a sterile procedure. You're going to start with whatever hand is dominant. I'm right-handed. I'm going to start with my right hand. If you were left-handed, of course, you would start with your left. So as you're going to go, I'm going to go towards my right glove. What I'm going to do is I'm going to touch the inside cuff of the glove and see how it's stuck. I'm just going to have to manipulate it. It's okay. This stuff's going to move around. Remember where your sterile field is. I'm going to tuck my thumb in because this just works best to get your thumb out of the way. But as I'm applying the glove, I'm going to start working my fingers through and my thumb, okay? So as I'm pulling the glove back, my fingers are still sterile, but the inside of the cuff is now not sterile. So if you want to, when you're careful, when you want to pull the gloves up more, you can. Just make sure I'm touching the inside, not the outside of the glove. I now have one sterile glove on. So to put your other glove on, it's kind of a little converse thinking. You're actually going to slip your fingers through the inside cuff at this point. One good idea is to kind of either not really tuck your thumb in, but kind of move it out of the way so you're not touching anything that's going to possibly contaminate it. When I'm putting this glove on, I'm going to actually keep my thumb out of the way for a moment, kind of work it in, but then tuck and go. Same idea. I'm working my thumbs through, my fingers through, and I can pull up. I'm still sterile. So as you put your gloves on, sometimes a finger may slip out, or you may put 2 fingers in one. It's okay. Just keep going with the motion. Get that sterile glove on. Put your other sterile glove on, and now you can adjust whatever you need to adjust. So make sure everything feels well before you start your procedure. Hands sterile. So now I have to be careful again about what I'm touching, what I'm not supposed to touch. Can't grab your phone if it rings. Can't scratch your nose if it itches. You literally have to be aware. My hands can only go where the sterile field is, okay? If you're having to wait for something, a lot of times what we'll do, we'll cross our fingers, cross our hands, because now I'm aware I can't really move my hands without breaking sterile technique. So in a nutshell, this is how you apply sterile gloves on, and I hope this procedure helped you.